Welcome to Science, Health and Healing Encyclopedia. I am Dr. Ali. Insulin monitored diabetes reversal. This is the title of my new book. In this book, I present a large number of case studies showing you exactly what ideal insulin profile is. How in health the body uses and needs extremely small amounts of insulin, fasting level of less than 2, 3-hour insulin level of less than 2, peak insulin of less than 25 to maintain a perfectly normal metabolism. If you're gaining weight, the probability is you are insulin toxic. There's only one way you can recognize that, by doing the insulin test. In the book, I explain to you how to do a 3-hour insulin profile. Sugar comes with it. I personally don't need sugar, but since most other doctors still need blood sugar, then this testing is also useful for them. Hopefully, they will begin to learn insulin and they will recognize, why would I devote a whole book to the subject of insulin monitored diabetes reversal, type 2. Type 2 diabetes is a problem of insulin toxicity for years and years. This, of course, is not new information. People have been calling it hyperinsulinemia. There have been thousands of articles written how excess insulin is bad for the heart, bad for the brain, bad for the kidneys, bad for the blood vessels, bad for the eyes, bad for the brain, bad for the nerves. It is profoundly ironic that with all this massive amount of literature on insulin, there hasn't been any focus to do insulin testing and then begin a program of diabetes reversal with clear laboratory evidence, objective, measurable, reproducible. And then see the dietary changes, the bowel, blood, liver detox, the supplementation, meditation, gentle, non-competitive exercise, all the simple things that you need for reversing diabetes. How do you know whether you're succeeding or not? The only way is by insulin testing. If the problem is excess insulin, insulin toxicity, then answer is to measure the insulin. Every other way of saying that you are improving or not improving, well, as far as I'm concerned, that's just fibbing, or that is just delusions, or it is self-deception. Now, I'm not saying that you cannot reverse diabetes without insulin testing. I am saying that you can do the right things without understanding it. But there's a certain joy if you know what you're doing. There's a certain joy to know that I have succeeded to a degree that any doctor, any place in the world will look at my insulin number and glucose number and say there is no evidence of diabetes. Now, this book is very easy to read. There is a profile after profile after profile. It is based on my personal body of sets of insulin and glucose profiles, more than 900 of them, collected over a period of almost 10 years. Even if you just saw 10 profiles, the ideal profile, let's say in a man, the ideal profile, let's say in a woman, and how you go into insulin toxicity, how either you clear it or the problem deepens. People are more and more using the term prediabetes, except nobody knows how to define it. And certainly no doctor can tell you whether you are making progress, whether your prediabetes is progressing to diabetes, or indeed you are moving to normal health. Nobody can tell you. Certainly by sugar testing you cannot say this. The only right way to do is to have the courage to let your blood give you the guidance. When you do insulin testing in your diabetes reversal program, you are learning the language of your own blood. If you don't do that, the rest is all figment of imagination. I would never belittle the experience of thoughtful, diligent, experienced doctors. I would never belittle the experience of thoughtful, insightful individuals, intelligent individuals who have managed their diabetes for years and decades. All I'm telling you is that anybody who's tried to regulate his diabetes, try to minimize the use of medication. Once you study this, you have to tell me, Dr. Ali, this is rational, it is logical, it is objective, it is reproducible, and so it is enlightening and it is scientific. You can get a copy of this book from www.aliacademy.org. I hope you would consider this. This much I know, that if you spend a little time with this book, you will not say, Dr. Ali, you betrayed me. I wasted my time. I thank you for joining me. I ask you to share this video with your friends and family. Let's become insulin intelligent. Let's become insulin literate. Let's reverse diabetes, lose weight healthfully, and let's not continue to be dumbed down by people who do not want to talk about insulin, and they will do anything except to do the right thing, which is insulin testing, and measure objectively whether you're making progress or you're losing ground, and if there are other things you need to do. Of course, in this book, I give you details of my breakfast recommendations, my lunch recommendations, my dinner recommendations, my recommendations for simple, daily, gentle bowel, blood, liver detox, my recommendations for gentle, non-competitive physical fitness program, and of course, some suggestions for a philosophic, spiritual approach to the problem. Again, I thank you for joining me, and I ask you to share this video with your friends and family. Thank you.